Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for dandruff. What is dandruff? Over the scalp, at the root of hair, small, dry, moist, whitish or greyish fibre-like substances accumulate. These are called dandruff. Besides scalps, dandruff may also be seen over brows, moustache, beard, hair about genitalia. Please note, creation of dandruff is a natural process. It cannot be stopped altogether. Neither it should be. Excessive dandruff is a disease, of course. Possibly this is the most common disease of all. How does excessive dandruff grow? Number 1, seborrheic dermatitis is the chief cause. Failure to clean hair effectively, malaria fungus, type of fungus, contact dermatitis, psoriasis, eczema and other skin diseases. Now let us look at the pictures. This is the dandruff. This is psoriasis. Look, the psoriasis, a very nagging type of skin disease. This is seborrheic dermatitis and this is eczema. What are symptoms of dandruff? Number 1, itching of the skin. Number 2, growing of oily and dry fiber. Uneasiness over the scalp. How does dandruff originate? Profuse sebum is excreted over hair skin following to seborrheic dermatitis. Seborrheic dermatitis is an infective disease actually. This excites this secretion of over production of sebum. Skin is inflamed. Malaria fungus naturally occurring in the skin brings about inflammation to generate new skin cell. Now, malaria fungus is there in our skin. It comes naturally and it brings about inflammation to generate new skin cells which die soon. These dead cells get mixed up with the sebum to produce white flakes, and dandruff is just like dandruff. Actually, dandruff is created by this thing. The skin cells, dead skin cells, sebum together produce the dandruff. Is dandruff contagious? No, it is not. Now here you see the sebaceous gland and the sweat gland, and just over the skin, beneath the skin layer, how sebaceous gland is lying and how these sweat glands are there. These are the hair on the skin. How to get rid of dandruff? Number 1, scalp must be kept clean regularly. It is a must. You have to keep the your scalp very much clean always if you want to really get rid of dandruff. Number 2, while shampooing hair, lightly massage the scalp. Do not scratch. Number 3, hair needs to be brushed at least twice a day, in the morning and at night before going to bed. For long hair, brushing should be done from the bottom upwards. Mind that brushing wet hair is damaging. Get hair dried before brushing. It is better to use brush with wide teeth. Number 4, mental stress must be kept low. There is another point. Avoid using different chemicals on hair. That is another very important point. If there is skin disease, it should be properly attended as treatment. This is a must. What are types of dandruff? There are several types having unique causes. Some are easily managed while others are very tough to tackle with. However, lifestyle changes, hair care, healthy practices together with proper remedy, each of those can be tamed. Types are dry skin dandruff. This is the commonest of all. It is usually noted in winter months as cold weather, indoor heating and washing hair with warm water makes skin palpably dry. So when the skin is dry, this is most commonly seen. The flakes are very small, white. This is the picture. Use moisturizer, shampoo, home remedy like coconut oil, scalp massage help a lot to overcome. Oily skin dandruff. Just beneath the skin lie sebaceous gland. These secrete sebum which keeps skin naturally oily. Sometimes these secrete too much of sebum, giving rise to problem of oily skin dandruff. These flakes are larger, more yellow than white, and more oily too. The use of the same type, that is shampoo, coconut, must help. Seborrheic dermatitis is a severe form of oily skin dandruff. It will be discussed later on. And this is the oily skin dandruff image. Fungus related dandruff. We already know that Malassezia fungus, we have already referred to this earlier, a natural habitat of human skin. This fungus is a natural habitat. In a few cases, this triggers a serious inflammatory reaction, creating a nagging type of fungus related to dandruff problem. This is the fungus type, fungus related dandruff. Disease related dandruff. These are again three types. Seborrheic dermatitis. It has already been mentioned that this dermatitis is a form of oily skin dermatitis. Eczema, also known as atopic dermatitis. It is an infamous skin disease too, and when it affects scalp, it produces larger than dry skin dandruff flakes. This is atopic or eczema. And psoriasis, an autoimmune condition where skin cells grow too rapidly, forming scales, and scalp psoriasis produces fine powdery flake resembling dandruff with distinct silvery sheen. Look this. So these are the types of dandruff, but mind it, in case of later diseases, I mean this seborrheic, eczema, psoriasis, I did not mention any medicine here because the medicine will be discussed later on as per homeopathic approach. We are not discussing modern medicine here. You can use those. Many things are available in the market, like this ketoconazole, one of the common thing. Then salicylic acid. So many chemicals are there, but I think these chemicals are will cause more danger than good, because this type of scalp eruptions are related to constitution of the person. So homeopathic disease will be acting more nicely, much more nicely than these modern medicines. So we will be discussing this thing now. Arsenic album for dandruff. Scalp is so sensitive that it can scarcely bear the hair to be touched, falling out of hair in bunches, forming circular patches which become dry and dirty. Scalp covered with dry, band-like scale, scabs, crust, sometimes extending down to forehead, ear, neck. Thuja oxygen dandruff. Subjects want face, head warmly wrapped. White scaly dandruff, hair dry, split, fall out. Subjects feel worse in cold, damp, hot weather, periodically at 3 p.m., 3 a.m. from tea, coffee, sweets, onion, fat foods. Feel better from warm wrapping, air, free secretions, sneezing, and crossing legs. Look this symptom. This symptom covers the whole person. The disease as well the person. These are the person symptom. When interpreting subjects, that is general symptoms. These are most important to categorize a particular person. Staphysagate for dandruff. Humid, fetid eruptions or dandruff on the scalp. Painful sensitivity of scalp. Skin spill off with smarting, itching. Worse evening and getting warm. Hair falls out mostly from occiput around ears. Subjects very sensitive to what others say about them. Feel sick from reserved displeasure. Violent outburst of passion. These are general symptoms. And this is particular disease symptom. When these two things match, then this will be acting very, very nicely, and the patient will be very, very better in all respect, mentally, physically, all respect. Briny album for dandruff. Scalp rough, uneven. Hair seems very greasy. Head cool to touch. Dandruff with vertigo in occiput. Bursting, splitting, crushing. Front-to-occipital headache worse from moving, coughing. Scalp very sensitive. Cannot bear even a soft brush, even hair pains. Even every hair pains. Subjects feel worse from least movement, raising up, stooping, better from lying still in a dark room, sitting up from cold foods and drinks. That is, this is all these are things that are better. So these are the subject symptoms, these are disease symptoms. Calamity for dandruff, scalp of children full of scarp, dandruff, crasta lactea. This is crasta lactea, the scalp of babies or child. Trouble starts after vaccination. For others, while scaly dandruff on scalp with itching, infallible for excessive dandruff owing to eczema. Mind this, eczema, I have already mentioned from eczema dandruff may cause. Tongue with white coating or brown coating, scalp full of white flower-like dust owing to excessively active sebaceous gland. Phosphorus for dandruff, profuse dandruff, hair fall off in bundle, scratching relieves itching, but later felt worse with burning. Vertigo often accompanies. Skin over forehead feels tight. There are a few skin symptoms and tongue symptoms have also been given here. This either brown coating or white coating. How it looks, that has been shown here. Gravities for dandruff. Eczematous dandruff, profuse scales on scalp, creating distasteful itching. On crown, burning in round spots. Sensation as if pricked by needles. Itching, scratching results in bleeding or secreting fine, thin, gluey discharge. Hair turns grey, worse on top and sides of the head. Foul, acrid, foot sweat. Calculator for dandruff. Profuse yellowish white, tenacious dandruff falling out from hair. Abundantly on temples and sides of the head, down to beard along with headache. Sensation of coldness on outer head. Multiple small warts on hands. Concomitants, vertigo, which go worse on turning head, ascending, scratching head. Skin is cold as serpent, flaccid, unhealthy. Trivial wounds do not heal easily. Icy coldness of the buttocks. These symptoms are additional symptom to pinpoint a particular case. These symptoms are particular symptom of the disease. These symptoms are general symptoms or other types of symptom which can singularize a particular case. Calisol for dandruff. During combing, falling out of brand-like yellow scaly dandruff. Hair fall off easily when combing or moist sticky yellow dandruff with bald head spots. Psoriatic and eczematous dandruff. We have already mentioned this type of dandruff. Psoriatic, eczematous. Skin dry, yellowish with abundant desquamation. Nitum muriticum for dandruff. Scalp very sensitive, feels constricted. When touched, hair falls out from beard, temple, forehead of head. Skin oily, dry hairs. Unhealthy, yellowish. White scaly dandruff with herpetic eruptions around. Flexures, dry eruptions on margins of hair. Warts on palms, hands. Whitish hives, warts on exertion. Subjects physically, mentally hopeless. Awkward. Suffer from emaciation, weakness, weariness. Despite eating well, trembling of the whole body from smoking. See, these are the total subject symptoms. These are specific symptoms. With this, the video ends. Thanks for listening and viewing. Any problem, please write down in the comment section. I will certainly respond.